Assalamualaikum warahmatullahi wabarakatuh. Today, we would like to discuss about Hvac system in hospital regarding the issue of COVID-19. Let's start with the introductions. The current global challenge of COVID-19 pandemic has crossed national, extreme, philosophical, cultural, and social and educational boundaries. The Internet of Things or IoT enabled healthcare system is useful for the proper monitoring of COVID-19 patients through the use of an interconnected network. This technology helps improve patient satisfaction and reduce the hospital readmission rate. Healthcare sector has been a front-runner in the adoption of modern technologies, which has led to the emergence of the smart hospital concepts. Although standalone hospital information systems have been enabling healthcare organizations to improve operational efficiency to a certain extent, smart hospitals that integrate end-to-end healthcare operations allow organizations to improve care delivery and patients' experience. So the objective of this assignment is to identify design, operation and maintenance of Hvac system, particularly in airborne infection isolation rooms and ICU rooms. The second one is to describe the ductwork and installation required for each mechanical ventilation system, heating, ventilation and air conditioning. The third objective is to identify smart hospital solution by using smart system and technologies. And the last objective is to determine how Internet of Things or IoT application that can be applied in hospital.
Our case study is the Hvac Medical Center, and it is located in New York. And since the month of March 2020, it has been announced that the hospital will be used as a hospital to treat COVID-19 patients. Before the event of COVID-19, the Hvac system used in the hospital is relatively normal. But since the pandemic began, the hospital have upgraded the system in order to meet the requirement that is instructed by the WHO. The first one is the isolation of the room. This is done by installing air curtain at the doorways. By installing the system, any particles of the virus that is floating in the air will not be able to exit the room where the patient is treated. Purification of the contaminated air is done before the air collected from the patient room can be released at the outside of the building. This is done by installing HAPA grade filter in the ducting system. The rooms that are used to treat the COVID-19 patients are kept at negative pressure. This is done in order to avoid any contaminated air from escaping the room, hence minimizing the possibility of the virus to spread to other people. This is done by monitoring and controlling the air pressure of the room. Maintenance of the system is done in order to ensure that the system is running at its full efficiency. This is done by checking the condition of the filter, checking the condition of the fan and the bearing, and lastly is by making sure that the refrigerant is kept at the efficient level. The Hvac system consists of three main principles, which is heating, ventilating, and cooling.
Okay, so next I'm going to present on the installation and the ductwork. So firstly, the anteroom is pressurization from internal area to a cleaner area such as office. Secondly, shall be maintained at a negative pressure except for the laboratory, because the laboratory has its own exhauster. And then for the third one is anteroom is known as airlock because it prevents the mixture of air between infectious patient of COVID-19. And lastly, the cleaner air is supplied from the anteroom and the pressure is maintained by using exhauster. Generally, the equipment used are such like supply venturi valve, pressure sensor, anteroom door switch sensor, anteroom pressure control, exhaust venturi valve, and lastly thermostat sensor.
COVID-19 pandemic puts a heavy burden on healthcare services worldwide. Much healthcare resources are now being reallocated to deal with the outbreak of COVID-19, which leaving many patients, especially those with other ailments, without proper care. So with the right technologies, hospitals can improve patient experience, streamline clinical process and limit hospital-acquired infections. And there are many systems and technology that can be a solution for smart hospitals. So the first one is artificial intelligence or AI solutions and 5G technology. AI technology can help doctors analyze computed tomography, quantification result of infection cases with high accuracy. It can greatly help reduce workload of medical personnel working with patients contracted with COVID-19. AI technology leverage computer vision and medical image analysis to segment multiple pulmonary ground glasses opacities and lung consolidations, while 5G network can assist COVID-19 treatment hospital to relieve network congestion and guarantee quality of medical care service. So in this way, it can screen enormous numbers of people and easily discriminate between those who may really be ill with COVID-19 and those who are likely to have less threatening illness. The second solution is integrated data dashboard. It is developed by the data analysis and data experts working with the integrated command and control center, which are now known as COVID-19 war rooms. The purpose is to fight the global pandemic of coronavirus. The system is used heat mapping technologies and predictive analytics where the city administration will develop a containment plan and the containment zones get reflected on dashboard. City administration is monitoring the areas and creating buffer zones where patients were diagnosed positive with COVID-19. The last solution, which is the third solution, is smart locking system. Traditional locks and cabinets within a healthcare facility are made up of multiple physical components, and every point of contact made while gathering life-saving equipment is a potential point of exposure to a virus or bacteria. This exposure can lead to an unnecessary, potentially deadly, which consequence for patients during the hospital stay, and this could include exposure to deadly viruses like COVID-19. So with a smart locking solution like SHAH system, medical staff members no longer need to handle a key or a physical lock. They can simply use an RFID card, wristband or badge affix tags to disengage a lock. The purpose is to reduce specific multi-person contact surface. So by integrating with a hospital existing technologies and designing a new smart hospital software, we help caregivers focus more on delivering care and spend less time that the things can be automated and performed by smart systems. Now, many hospitals are already on their way to transform their technology of healthcare delivery as for becoming smart hospital with the latest technology and where everything is and everyone is linked and connected.
Hi, my name is Emilia Samil and I will continue on for the presentation of Smart Hospital Solution. So for my part, I have came up with 3 hospital solutions or suggestions. The first one is by using high technology temperature checks. So as we all know, a fever is a common symptom for many diseases, ailments, and sort of virus. This is also including coronavirus. So during this pandemic, most healthcare and tech companies are improving or enhancing their usual temperature checking methods, which is also not involving any close contact between one another. So this is very important. So one of the examples that I can present is in China, their security guards for malls, hospitals are actually wearing futuristic glasses. This is used to screen people's temperature, and it also does not require any close contact between the security guards and the people or the public. So yeah. So for the second one, I have came out with a proximity trace wearable devices. Now what this is this device will help to detect any close contact between another worker, hospital staff, or a worker and a patient. So when there is a close contact between one another, the device will send an alert to the users to inform that they had exceed the safe distance between one another. This device will also allow its user to obtain data to see who they work with, just in case one of their staff members or workers are test positive for coronavirus. Last but not least is a fever tracking application, and as you all know, I think it's one of the most used app in Malaysia in the moment. This application generally is designed for people who self-quarantine or self-isolation after being suspected to be exposed to coronavirus. So how does this work is that its users can access the application itself while recording their temperature using a digital thermometer. Now it's very important to use the digital thermometer as it will provide more accuracy in terms of detecting your high fever and so on. Therefore, later the app algorithm will able to identify any worsening of symptom, and by this they will be able to alert the patient's healthcare providers just in case worsen symptoms. So that's all for my part, and thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Amirul Hisham. So I will explain for part B, number 2, which is IoT applied in hospital, which is to improve the administration, management, patient monitoring and treatment procedure. So we go for the first part, which is administration. Okay, Internet of Things can improve the administration at the hospital, which is the system can help to record and collect the information about the staff and patient in the hospital. This system can easily track the information about the staff and the patient in the hospital. Okay, next for the hospital expenses. When the hospital buy such as pump oxygen or bed for the patient, so this system help the hospital expenses automatically. Okay, so which is the higher ups can easily track all the hospital expenses. Last, this system also help to keep the hospital safe, which is this system can track any person who break the rules in the hospital, such as smoking. Okay, so when there is a person smoking in the hospital, the alarm will ringing. So we go to the next point, which is management. Okay, IoT can help to improve the management in hospital, which this system use radio frequency identification tag. Okay, most of IoT device will tag with sensors, which it is used to track the real-time location of medical equipment, such as wheelchair and oxygen pump or other equipment in the hospital. Okay, this system also can help to track the doctor in hospital. So when the hospital needs the doctor, so this system can help to track the doctor. Okay, next we go to the patient monitoring. Internet of Things can improve the patient monitoring in the hospital, which this system use remote health monitoring device. Okay, what is remote health monitoring device? This device is like our smartwatch, which is the device help us to track our heartbeat, blood pressure, and our glucose in our blood. So the doctor can monitor the patient through online, which they can collect all the data from the remote health monitoring device. So it will save the patient time, which is they no need to see the doctor. Okay, we go to the treatment procedure. With Internet of Things, treatment procedure can be easily run, which is this system can help to reduce the time. For example, the discharged patient in the hospital can update their symptom or their to the doctor through online. Okay, next, any person who want to make the appointment with the hospital can make the appointment through online. After treatment process, this system help the hospital record the treatment data for the patient, and the data of the patient can be updated from time to time to ensure the patient will stay in health. Okay, so there is many advantage of Internet of Things when it is applied in the hospital. So it will ease the staff and the patient in the hospital. Okay, that's all from me. Thank you.
As for conclusion, the first one is the hospital shall provide adequate numbers of isolation room. The second one is clean air shall be sufficient for removal of microorganisms. The third one is the air quality shall be maintained. And next, shall meet the requirement purposes. Installation shall be good, and the application of the smart system and technologies. And lastly is the improvement in using the Internet of Things in the building.